Thank you, Mr. the President of the panel, for giving us the floor. Mr. the President of the panel, honorable members of the panel, ladies and gentlemen, the research work that we are going to submit to your appreciation today is entitled Epidemiological Clinical Features, Aetiologis and Pronostic Aspects of Acute Transverse Myelitis in 4 university hospitals in Cameroon. This translate work was supervised by Associate Professor Lamancha. This is our plan. After a brief introduction, we will set the floor for acute transverse myelitis. We will present the objectives of this research, followed by the methodology that we use to achieve them. Then the results obtained will be discussed in the light of the other studies, and we will end our presentation with a conclusion. As introduction, acute transverse myelitis is a rare neurological condition characterized by focal inflammation of the spinal cord, resulting in sensory, autonomic, and motor dysfunction. Its incidence is low among population, and etiologies are diverse. Data on acute transverse myelitis are scarce in Africa due to diagnostics and management difficulties. Our objectives were to describe the clinical and paraclinical characteristics of acute transverse myelitis, to determine the etiologies, to describe the management of acute transverse myelitis, and to research the factors associated with poor outcome. Our methodology. We carried out a multicentric cross-sectional study in 4 university hospitals in Cameroon over a period of 6 months. All files of patients who were hospitalized in neurology and intensive care units and those who met the diagnostic criteria for acute transverse myelitis of the Transverse Myelitis Consortium Working Group were included. Data collected included socio-demographic characteristics, medical history, clinical examination, and diagnosis. Results of biologic analysis as blood analysis and cerebrospinal fluid and element of the treatment were noted. Magnetic resonance imaging or myeloscan were also noted. Mortality was also noted. While functional recovery was assessed by the Bartel index, we said that patients with Bartel index less than 60 had poor functional outcome, and those with Bartel index greater than or equal to 60 had good functional recovery. Data analysis were performed using the statistical package for social sciences software version 23.0. The Fisher and Mann-Whitney U test were used to investigate factors associated with poor outcome. The repeated measures of analysis of variance was used to compare the Bartel index means at 3 months, 6 months, and 12 months. The Kaplan-Meier survival estimator was used to assess survivals at 12 months post-acute transverse myelitis. Mr. the President of the panel, honorable members of the panels, our results. A total of 35 files were included in our study, with a predominant female population at 71.4%. The mean age was 36 years, and these results were similar to those of Professor Silva and collaborators, who also found a mean age of 32 years old. 31.4% of patients were known to be HIV positive, and the most common neurological disorders were motor and autonomic, present in all patients, followed by sensory disorders in 91.4%. Cerebrospinal fluid showed pleocytosis in 77.1% of patients. Hyperproteinuria was present in 94.3% and hypoglycemia in 22.9% of patients. The main etiologies of acute transverse myelitis were neuromyelitis optica, tuberculosis, lupus, and HIV. Initial management was based primarily on corticoids bolus, and functional recovery was good in 1 out of 2 patients and was essentially in the first of 6 months after the diagnosis of acute transverse myelitis. Concerning the prognosis of this condition, on this mortality curve, shows the nearly 1 in 2 that shows that nearly 1 in 2 patients died during the year of diagnosis, and these results were different from those of Flores Silva and collaborators, who found a mortality rate of 21.0% after a median follow-up of 6.5 years. This could be explained in our context by the late diagnosis, as well as by the high cost of the management and follow-up of patients with this condition. Factors associated with 1-year mortality were age over 40 years and history of HIV. These results were also different from those of Flores Silva and collaborators and those of Quintanilla and collaborators, who did not find any mortality during patient follow-up. This survival curve, which shows that the probability of survival at 6 months for patients with age over 40 years were nearly 5 times greater than that of the older ones, and these results are different from those of Saison and collaborators, who found an association between mortality and bladder catheterization after follow-up. In conclusion, the clinical presentation of acute transverse myelitis is identical to that found by other authors. Etiology is mainly autoimmune, and 1-year mortality is high in our context. Mr. President of the panel, honorable members of the panel, we are at the end of our presentation. Thank you for your attention.